Welcome to the Researched RN podcast. I am your host, Stephen Kuzmenko. In this podcast, I discuss new and interesting peer-reviewed research articles from various nursing researchers and other professional publications. In the 10th episode, I'll talk about an article published in the February 2025 edition of the Journal for Nursing Care Quality titled Integration of Virtual Technology and Artificial Intelligence Improves Satisfaction, Patient Safety, and Nursing Workforce Efficacy. It's authored by Taransky and colleagues. So first of all, I want to say welcome to the episode and thank you for tuning in. This is the 10th episode of this passion project that I am doing. And so in this episode, I'll summarize this article that highlights what AI potentially can do and how it might be able to enhance the nursing workforce. To start off with some background, we know that the nursing workforce is only getting worse. It's hard to retain and train staff and keep them engaged. There's a lot of opportunity throughout this profession, and so we know that, we feel that, especially those of you that are in leadership and or education working in orientations. We know that there's a shortage of nurses in the workforce, and it was exacerbated by COVID, but it was there before COVID. The other thing that's going on is our population, at least in the United States, but globally, is aging. People are living longer and longer with advances in healthcare treatments and surveillance systems for chronic diseases. And so you have less workers and more people that need those workers. So you can see that this is a recipe for some challenges. And so what these people did in this article, they used AI and were able to leverage the limited resources that they had in nurses and in nurse aides, all while enhancing patient safety and improving their outcomes. So they really talk about why it's important that we rethink the systems of care, how we provide care in nursing. Some of the barriers that they do actually mention in this article, the barriers to technology can include cost, lack of technical infrastructure, user perception, and uncertainty on the return on investment. And so how these researchers used AI to enhance the nursing workforce is it was in a South Central Pennsylvania healthcare system that had 8 hospitals. And of course, they faced issues with recruitment and retention, just like all other healthcare facilities in the United States and probably elsewhere in the world. They had implemented virtual patient observation, VPO, and they had success. And so VPO is someone in a room who's watching a patient via a camera, and this allows them to maybe see patients that are far away. If they need to alert the nurse aide about something, they're able to constantly have eyes on them, virtual eyes, and they can call the nurse, hey, I'm alerting you about X, Y, and Z. So that's kind of what VPO means. And then with virtual nurses, these are nurses that exist in healthcare settings that provide care through the interface of technology, cameras, microphones, speakers. This allows for admissions to potentially be done sooner, for discharge planning to be done sooner and implemented, as well as the implementation of education. So, you can have a virtual nurse that is in one place, but helping to do admissions of patients across either an entire hospital, an entire unit, an entire healthcare system, whatever it may be. But, this technology is advancing, virtual nurses. I have seen it in my healthcare facility. I don't know if you have it in yours, but they mixed virtual patient observation with virtual nursing and AI. So let's continue to think about, or let's continue to talk through how they were able to do this. So this was a nurse-led quality improvement design, and they were aiming to assess the impact of the virtual patient observation, VPO, and virtual nursing programs over a time, and specifically how an AI model can help them predict patient fall risk sooner so that they could intervene and hopefully prevent falls. The unit that this took place was a rehab and brain injury unit at a magnet-designated hospital, 53-bed unit specializing in rehabilitation and brain injury. And they had already used the VPO and virtual nurse, so they were already kind of used to that technology. Not only the actual virtual nurses, but also the staff were used to like kind of the cameras and the microphones and the speakers and someone kind of phoning in and saying, do you need any help? If you've never experienced that in your practice, it is different, but it can be very helpful. So the unit was chosen due to its stable demographics, moderate acuity level. The patients there required 3 hours per day of rehabilitation, and on average, the patients stayed about 14 days. So a long time these patients need to recover to get back to their baseline as close as they can be. Of course, they're weak. They had brain injuries, so a good area to implement any kind of fall prevention intervention. So the interventions themselves, the VPO with AI was piloted. That was kind of the whole point of this project. And so it's intended to replace that physical one-to-one sitter, that person that has to be there all day, all night, for however long the patient needs to be observed. And so with this AI, it was able to recognize certain patterns of behavior in the patient. So that could be impulsivity, cognitive impairment, as well as other safety concerns. Now, one thing that I do want to mention is that the patients that were eligible for use with the VPO and AI were easily redirectable. So patients that, follow commands, that if you tell them to, hey, get back down, someone will come in, they do that. And so that they're going to be our patients that are not easily redirectable. So just wanted to mention that, as well as patients that were at high risk for elopement and or those with suicidal or homicidal ideation. Those patients also were not included in this quality improvement VPO AI project just due to their safety policies and procedures. So the virtual observer, the VPO with AI, had 16 patients that they were able to monitor at one point. So that is a lot. And the way that they made this AI software was that there were boxes around the video screen of the patient, and that box would either be green, yellow, or red around that patient's view, the view of that patient. Green if it was low risk, yellow if it was moderate risk, and then red if it was high risk. And so this AI was able to identify concerning signs based on how it was built, and based on those assessments that the AI was making, it would change the color of the box around the patient. And so that virtual patient observer, if they saw a red box, they knew they needed to phone in and say, hey, get back. They did have pre-recorded verbal commands, but this helped kind of triage, maybe is a good way to say, which of those patients were at higher risk in that moment, so they would have to intervene sooner. And then, so if they had a bunch of green boxes and everything's okay, right? If they had a couple yellows, they're going to be looking. If they have a red, they're going to be tuning in and saying, hey, what are you doing? So after training of what this VPO and AI does, kind of what I just told you with the clinical staff and the nurse aides on the unit, but then also the virtual nurses that were going to be watching, after all the training took place, they finally implemented this. And it was kind of interesting, this AI, I've never worked with AI in healthcare, but it was interesting. They actually had to retrain the AI, which delayed about 4 weeks, this project, because it was getting confused on their clothing. I guess this unit, they note that patient clothing variability posed a challenge in the AI model, kind of recognizing that patient and that machine learning to take place quickly. And so they ultimately taught the AI to look for the safety socks. So these could be like bright colored, those slip resistant safety socks, and then the patient ID armbands. That's kind of how they trained the AI to look for the patient, to know where they were and exactly what to look for. A little bit about the virtual nurse. This was a core group of bedside nurses that had at least 2 years of experience, and they also expressed interest in the program in championing that virtual nursing role. And one of the other things that they also tapped into with this, and one of the outcomes that I'll eventually get to, is that they also approached/asked nurses that needed light duty or were on some kind of workplace restriction. They're not able to perform physical tasks. So they actually were able to use their resources more efficiently, which I'll get to later on. But there was a core group of nurses. The service was only provided between 7 a.m. and 7 p.m. Monday through Friday. And the nurses that were virtual nurses, as long as they were able to, also went into bedside care. So they would, take care of patients 1 or 2 days a week. And then that third day or however often they worked, that would be when they rotated into a virtual nursing role. So that kind of gave them a little time away from the bedside, those physical demands, emotional and mental demands of bedside work. It gave them a little break, which I thought was really good. Okay, so what did they measure to know that this would have been a success or was justified? So the primary outcome was reduction in falls. And so they measured that through falls per 1,000 patient days. They also looked at patient experience metrics related to nursing care provided while they were hospitalized, and as well as the nursing care provided during discharge. And then they also queried the actual nurses themselves, and they wanted to ask them a couple questions related to whether or not the virtual nursing program, this VPO AI program, enhanced the flexibility in their role and then positively contribute to their health and well-being. That was kind of the first question. And the second question was also asking whether the nurse thought that it enhanced patient safety and quality in their department. So those were questions that they specifically asked the nurse. As far as the process measures that they were looking at, they were monitoring how many patients per day were monitored by VPO and how much that would equate to for in-room one-to-one sitters on a monthly basis. They also looked at the percentage of virtual nurses that were filled by light duty or those activity restricted nurses, as I mentioned a little bit ago, just so that they can see whether the resources that they had were used optimally. And then they also looked at the additional activities that these virtual nurses would be doing. In addition to the VPO AI looking for falls, they also use this virtual nurse to give admission, discharge, and education sessions. And so they also calculated how much time the virtual nurse spent doing that so that they can see what that would have saved in person, those nurses that are on the unit taking care of patients, how much time it saved those nurses in having to do the admission, the discharge, and the education sessions. So finally, the results. They found a pretty significant reduction in falls, 59% reduction in the monthly fall rate. It went from an average of 1.4 falls per 1,000 patient days before the intervention, and after the intervention, that went down to 0.84 falls per 1,000 patient days. So that is a huge improvement in patient safety and, of course, cost, because there's falls with injury that require additional diagnostics. So I think that's a very promising finding, really good finding that this AI was able to help them do. With the patient experience, when it comes to the nursing care and the overall discharge process, the nursing overall median score increased from 64.7 to 76.5. So that's a 12-point improvement from pre to post implementation. The discharge overall median score also increased 60.3 to 69.4. So overall, the patients that were getting the nursing care when it was provided virtually and the discharge process when it was provided virtually, they did seem to have satisfaction and also improve satisfaction favorably, even though it was provided virtually. And so we had a reduction in falls. Patients seemed to have better satisfaction. What about the nurses? How did they perceive this? Of the nurses that responded, over half, 53.9%, strongly agreed that the program increased their workplace flexibility and positively contribute to their well-being. And then when it came to improve patient safety and quality, even better, 85.6% of the respondents reported that this project improved patient safety and quality of that unit. Now, this is a pretty small survey. It was an average of 44 nurses that completed the 7 anonymous surveys that were administered throughout this study process. So, of course, this is a pilot study. This is a small quality improvement study, but I think that is really good results. As far as the process measures, so these are kind of like some of the financial return. How did this affect labor, the sitter hours, and the observation coverage? So the VPO with the AI resulted in a 91% reduction in the median sitter hours. That was 1-to-1 sitters. So before it was implemented, the median was 482. It went down to 40 hours. So I think that is a pretty significant reduction. So they were able to reduce the 1-to-1 sitter hours pretty drastically, but they drastically increased the overall patient observation hours. The monthly average before the intervention, they were averaging 556 hours of patient observation. That increased substantially to 7,163 hours, over 7,000 hours per month of patient observations, but they did not need to use the 1-to-1 sitter. So remember, that was that virtual nurse with watching up to 16 patients at once, but that AI is helping them triage, or I guess prioritize, which of the patients they need to contact first. So they enhanced overall observation hours while cutting down on those 1-to-1 in-person sitter hours. The virtual observers were able to monitor on a daily basis about 9.6 patients. So they were watching, at least 9, maybe up to 10 patients per day. So that's the cost savings, because if you had to have 10 people individually watching those 10, that's a lot more money than having one person with this virtual AI helping them. The additional process measures, how did this actually benefit the bedside RN time and staff allocation? The virtual nurse during the intervention period was able to manage about 40% of the total admissions and 48% of the total discharges. So they were taking on a fair amount of work that the bedside nurses didn't have to do, didn't have to spend all that time on the EMR and clicking through all of the things. And they also conducted an average of 40 patient education sessions per month. And so that to me is a long time. Those bedside nurses were able to meet more higher priority needs. I know patient education is crucial to provide, but when you prioritize care and there are things that are much more urgent and potentially emergent, then you're going to prioritize that over providing patient education. So the patients were still able to get their education, but it was provided virtually. With these education sessions and the admissions and discharges, they report that this saved an average of 63 hours per month of the bedside nurse's time. So that is a lot of hours that are then provided to the patients that are on the unit in person and potentially have more acute needs. And then when it came to those light or activity restricted staff that they were prioritizing to the virtual nurse role, just because they couldn't be on the unit lifting patients and walking patients, whatever they couldn't do, with those light duty or activity restricted nurses, an average of 269 hours per month were given from a light duty or activity restricted nurse. So that's a fair amount of this role, this virtual nursing role, being filled by clinical staff that is really one of their only options to keep working. So it's really benefiting both the organization as well as the staff, because they can still work and help the patients. If you have manager talk, those 269 hours per month was equivalent to 1.58 FTEs. So that is a pretty significant contribution. So those are the results. And now moving on to the discussion. From this innovative quality improvement project, we can see that this team of researchers and these healthcare leaders, bedside nurses, were able to reduce falls. They were able to increase the number of observation hours while reducing labor costs by enhancing the number of patients that one person can watch. And they also had improvements in patient experience and nurse satisfaction, and also saved bedside nurses time to address more critical needs, not having to spend time in the EMR, documenting an assessment, documenting an admission or a discharge, or having to provide education sessions. Nurses also perceive that this enhanced their work flexibility and patient safety, the quality of care that was provided. So the nurses perceived that this was a beneficial project, beneficial improvement to implement in their practice. But while the nurses in this study, they viewed this VPO initiative positively, they note in the discussion that there are mixed feelings whether or not staff perceive that these VPO programs actually do promote safety, just because there might be perceptions that they don't actually prevent safety events. As I did mention, the inclusion criteria for these VPO AI patients were that they were redirectable. I don't know if anything virtually or any kind of AI can ever replace just a person being there and potentially physically stopping them from doing something they're not supposed to be doing. And so that's something to consider as well, whether or not, virtual observation is something that is beneficial based on the population of patients that you have in your clinical practice. One of the other secondary benefits that they kind of anecdotally reported in the discussion was that this virtual patient observation initiative reported what they called safety catches. So these were things that the virtual nurse were able to observe and tell the clinical team that they needed to address in some way. So things like the bed alarm wasn't activated, the call bell was out of reach, the bed rails were left down, oxygen tubing became disconnected. The patients, in some cases, received food trays despite having NPO orders. So these are things that anecdotally they report that this virtual nursing program was able to identify. So of course, they're not necessarily quantifying the occurrence of this or if the outcomes are because of that, due to that, but other things that are positive. You have a second set of eyes that's constantly there. They're looking, they're going to be able to see this happen while the nurses are running around, giving meds, physically assessing their patients, reporting findings to the physician, going in for scans, whatever it may be, rehabilitation. So there's a lot of things, a lot of distractors in the clinical setting. So having another pair of eyes was helpful for the staff as they report in the discussion. So the implications of this might be that it can enhance the nursing workforce. Now, I don't think that AI can ever replace nurses, but I think AI can help augment and make nursing more efficient. And this is one of the ways that it can do that, is by kind of helping us identify patterns and saying, hey, you need to take a look at this. I'm not going to decide for you, but you need to take another look at this and see if there's something that needs to be done. So if this is something that, you want to consider, of course you have to determine whether or not your leadership is open to integrating these new technologies. there are barriers, cost, whether or not you have the infrastructure, whether or not your other staff are going to buy into this kind of program. And then there's also some ethical concerns. Those are some of the challenges and things you have to consider is things like patient privacy, consent, and whether or not patients actually trust this technology. So, there are some barriers that you will have to address, but I think that the potential is there. We still can't forget that nursing should still be patient-centered care. We should not be technology-centered, but virtual nursing can be patient-centered, and I think in this case it was, and it's just we're using the technology to deliver care more efficiently, kind of where the patient's at. And so some of my final thoughts with this article, I think it would be pretty cool to see this monitor of 16 patients and see what that looks like and how to click through and communicate. I think that would be really interesting to see for me personally. I think that I would work in an environment where this does exist. I think it can augment and enhance our decision making. It doesn't make the decision for us, but I think it can help us. And so if you think this could be something that you can use in your workplace, ask your fellow nurses. Do you think that this is something that you would also embrace? Do you think that this is something that can enhance patient safety? So I don't want you to go and say we have to implement this tomorrow, because there are a lot of barriers, a lot of things to consider. But I think this is just shedding light on some of what AI can do for us in the future. I think this is just the beginning. I think that we're going to be able to have AI programs on our phones, on our watches, and they're going to help organize our thoughts and identify things that maybe we're not seeing. So there does need to be a lot more research in this field. That's something that the authors also note in the last parting thoughts of the discussion. So we don't quite know a lot about how AI can enhance VPO and virtual nursing. This is really just the start. So we need to look at things of how does this actually improve cost effectiveness? How is this actually integrated into practice? And then how does this impact other patient populations? I mean, this was a specific rehabilitation unit, patients with brain injuries, but how does this affect pediatrics? How does this affect medical surgical units, gerontological units, critical care units, EDs? So there's tons and tons of settings that this still needs to be looked at, but I think that it's promising. And I wanted to mention an article about some aspect of how AI was improving nursing care. I mean, I hear a lot about it. And so I also want to mention that my podcast, what you're hearing now, this is my voice. This is not AI. I am not using AI voices to make this podcast. But I think it's something that we might see more of as we read more books and papers as this technology continues to develop. And that is a wrap on the 10th episode of the Researched RN podcast, your virtual journal club on the go. I am your host, Steven Kuzmenko. I'll have new episodes out at least monthly. You can email me at researchedrnpodcast@gmail.com with any articles or topics you'd like for me to discuss. If you enjoyed today's episode, please share it with a friend, and it would also be a huge help if you gave me a positive rating so that others can find me. Thanks for listening, and be sure to tune in to the next episode.